Yeah, that's the clock I'm using.
Talk about your introduction. Talk about your IRB, and then we have to call the parts foundation. Part your foundation. You just have to remind me because it's involving your research. But okay, so those are the three things we gotta do today. That's fine. I'm probably not leaving until we. But because I want to give your intro and methods to them so they can start figuring out who they want to get recruited. Because we want to get you earlier is better. No, I'm calling to make sure they actually got it because I didn't know. Oh, okay. So we're just gonna call on it. Just. And beyond. Nervous. I was like driving to it. Do you guys keep appointments?
Since you're now an official member of the team.
Are you sure? Oh my gosh. I know. What?
Folks, we're going to get going in about 3 to 4 minutes or so. So just to kind of give you a 2-minute heads up and stuff.
You're best. Yeah, what you're doing.
I will call the room to order, quickly introduce you and Kelsey and thank the students for coming, and then very quickly I'll be we want to have them all up there to start, or that's your call. But I want to acknowledge them. Do you guys all want to stand up there to start? And then go to your seat after? Want to do that?
Just giving you an answer.
Everyone get up here. We want representing members of the team. So Kelsey and I will be like here, and if you guys could just kind of form a wall and get on.
I just want to make sure, because I'm paranoid and I've been having camera issues, people that got dirt in it, because I want to see a horse. Okay, I was trying to be smooth, and I was just saying stupid stuff about the horse and the dirt. My sock is fabulous. Okay.
2 to 3 minutes. So at the start, so I'll just introduce like you as representative members of the team, and then you can go sit down. I want to show all the
Twinsies, how are you?
Hey guys, can we get you over here for a quick picture with Logan first before we get going? Oh, okay. But you can do it. We've got 2 minutes. Yeah. Why don't you guys move over here and have a quick picture? All you guys at the end, you gotta pretend you like each other. You gotta show me over there.
Yeah, awesome.
resume your earlier positions. Okay, that's very well.
Just a second, Mark, we'll get that for him.
Turn it back on, Jordan, and we'll go.
Wait, didn't we want you up here at the start? I want to get
Keep coming back here.
at least at the start, so
Yep,
I
come on back.
introduce that it's a team effort and this is representative members of the. Come on, come on, come on. Sid, you coming? Just for the first 30 seconds.
Folks, we're going to get going now, and thank you all for coming, whether you're online or you're in person. My name is Marc Edwards. I work here at Virginia Tech, and I'm going to be, it's a great pleasure to introduce Marc Edwards and the Flint Water team that has done tremendous amounts of research and work over the past year or so. And I'm going to quickly just pass it to Marc Edwards for introductions of the broader group and the individuals who will be speaking. Just a couple of ground rules real quick is we're going to have these guys present their results. Then we're going to take questions from people here in Blacksburg, and then we're going to open it up to all of you who are online on the conference call. So once we're done with questions here in the room, we'll take conference calls next. Thank you. Mark?
Okay. Well, thank you so much for coming today so that we can present our results of the Flint resident sampling from March of 2016. And this was really an amazing team effort led by Flint residents themselves. There was a team of about 10 residents led by Leanne Walters, who worked on this for about 2.5 weeks, and as well as 6 Blacksburg students who went to Flint, gave up their spring break to coordinate the collection of lead and drinking water samples. And those samples were shipped to Virginia Tech, where they were processed by, this is part of our team here at Virginia Tech, the Flint Water Study team. And so Dr. Kelsey Pieper, she's going to be presenting the results today as a representative of the team. So with that, I wanted to first go into some scientific concepts that describe how it is that you get clean water from the treatment plant all the way to the consumer's tap, because these concepts are important to understand the current and past problems of the Flint water system. The first important concept is the idea of a protective scale that forms on the wall of pipes. So the current corrosion control that's being used in Flint right now, and this was implemented by the A-team at the U.S. Environmental Protection Agency as well as the state of Michigan, is called orthophosphate corrosion control. And this is what Flint was using for decades before the switch to the Flint River water and dosing of orthophosphate was stopped. And the way this works is that the orthophosphate reacts with materials that are on the wall of the pipe, whether it's lead or iron, and it forms a very protective coating. And what this coating does is that it protects the water from the pipe corrosion, and it also protects the pipes from the water. So this is essential. And so one of the key things to helping this system recover is to form this orthophosphate metal lining on the pipes throughout the system. And of course, that requires flowing water. We have to get water with the orthophosphate into the system and allow it to contact the pipe. The second and another very important element of a healthy distribution system is the issue of deposits. And in Flint's water system, they have a very big system for the amount of people that are currently left in Flint. And what happens over the years is that loose lead and iron rust have accumulated inside these pipes. And the way the water is currently being used, relatively low flow volumes, relatively low flow rates, we have learned in the past few months that it's probably going to take months or years to get these deposits out of the pipes and to clean these pipes up. And so this is one of the concepts that we're going to be promoting today and in the months ahead in collaboration with the EPA and the state, is that if we want to help this system recover, we have to get water moving through these pipes to speed up the rate at which these loose deposits are removed into the water. And this is going to require more volume of water moving through the system, and also in some cases higher velocities to clean those deposits out of the pipe. And the hope is that if we implement this, the system will recover in a few weeks or a month, as opposed to the months or years time frame that I mentioned previously under existing flow rates. The third and final point is that to have a healthy drinking water distribution system, you have to make sure that bacteria are under control. The bacteria are the source of the possible Legionnaire's disease outbreak that was associated with a switch to Flint River. And of course, the way we do that in Flint is through use of free chlorine. And so again, the general idea is that the chlorine is added at the water treatment plant, and we have to get that to contact the wall of the pipes to make sure that the biofilm is under control. That will prevent a lot of taste, odors, bacteria problems, which include Legionella. So for all three of these perspectives of having a healthy distribution system, we have to move more volume of water through the system at higher velocities, and that's going to be one of the bases for our recommendations later. So with that, I will now turn this over to Dr. Kelsey Pieper, who's a member of the Flint Water Study team, and she's going to present the results of our lead analysis, again, that the Flint residents coordinated in March 2016. And we're going to be comparing it to the historic analysis that they did in August 2015 when we discovered the widespread lead problem in the Flint system. So with that.
Thanks, Mark. So as Mark said, we're going to be comparing March 2016 to August 2015 in terms of water quality to look at improvements after the switch and look at the benefit of the corrosion control. So in both years, we used the same sampling protocol. This was, as Mark mentioned, a collaborative effort with the residents of Flint. We sent them up sampling kits with instructions. They distributed it. And we instructed the homeowners to collect water samples from a drinking water outlet. So this was a bathroom or a kitchen tap. We asked the homeowners to let the water sit for a minimum of 6 hours, and then to collect the first draw of water with a 1 liter sample. The homeowners were then instructed to flush for 45 seconds and collect an additional half-liter sample, which we'll refer to as a 1-minute flush. The homeowners were then instructed to flush for a final 2 minutes and collect an additional 250 milliliters of water, which we'll refer to as the 3-minute flush. As this was a voluntary sampling effort, it was really up to the homeowners and the residents in Flint to get these kits out, and we had great participation rate. In August 2015, we had 90% of kits come back, so we had 69 sampling kits returned. We then sent 269 sampling kits back up in March 2016, and we had 70% come back with 187. Today, what we're looking at is the before and after picture, so we're going to focus on the 174 homeowners that participated in both 2015 and 2016. So this is the data that we've generated as a comparison between August 2015 and March 2016, and I'm going to walk you through some of our main conclusions that we've seen so far. The first one is looking at our compliance with the lead action level. In August 2015, 19% of the samples of the homes that we received exceeded the EPA action level of 15 micrograms per liter. In March 2016, that number was reduced to 15%. We see this is consistent with what's going with our 90th percentile, as 10% of our homeowners are still exceeding 29 micrograms per liter in their water. This has been reduced again in 2016 to 23 micrograms per liter. Now, what's really important is when we talk about the lead and copper rule, no more than 10% of systems can exceed 15 micrograms per liter. So we're still thinking that this water is not meeting federal requirements. Looking at our 3-minute flush, we're seeing great improvements. In August 2015, our 90th percentile was 7.6 micrograms per liter, and that was halved to 3.4 micrograms per liter in March 2016. In keeping, as we continue to reduce these concentrations, we're seeing more homes with non-detectable levels of lead in their water. So looking at the first draw, in 2015, 10% of samples came back with non-detectable lead. That increased to 38% in 2016. And this is consistent across all 3 samples we took. So really what we're getting at is we're seeing water quality is improving in terms of lead. However, there are still some problems. In 2016, in March, we did find several homes that had extremely high levels of lead. our maximum concentration went from 158 to more than 2,000 micrograms per liter in 2016. This in turn increased our average lead concentration for our sampling effort. So this next graph is reporting the same information, but we thought it was really important to talk about how lead changed at the household level. So on the x-axis are the first draw concentrations we collected in August 2015, and then on the y-axis are the corresponding first draw samples we collected in March 2016. You'll see there's a solid diagonal line that is a one-to-one line, and that tells us data points that end up on that line means that the concentrations in 15 and 16 were the same. Any points below that means they had higher lead levels in August 2015 compared to March 2016. Anything above, we had higher concentrations in March 2016 than we did in August 2015. We found that 71% of the homes had lead below the EPA action level during both sampling campaigns. 5% of homes had lead above the EPA action level during both sampling campaigns. 14% of our homeowners had high levels only in 2015. And what was concerning is that 10% of homes had lead levels above the EPA action level only in 2016. So this is really hinting at the fact that there's a lot of variability with the water, and so we wanted to look at the relationships. So we ran a linear correlation to understand how predictive sampling is between years. So can we identify a home with high lead in August 2015? Would that be predictive of finding a home that exceeds EPA action level in 2016? So we did this. You can see there is a red dashed line. This is our correlation, our relationship between the data. When we have an R-square of around 1, this means that it is predictive. There's a strong relationship between them. An R-squared of 0 means there is not. It's more random. It's more sporadic, highly variable. As you can see, our R-square is lower. It's more towards 0. This means our data is more, there's not a good, strong relationship, so it's not predictive. To emphasize this, there are 2 points I want to show. The first one is that in 2015, this home was above the EPA action level with 17 micrograms per liter. But then during our March effort, we found this home went up to more than 2,000 micrograms per liter. The opposite case happened for this homeowner. In 2015, they had over 100 micrograms per liter, but then in 2016, it reduced below the EPA action level to 8 micrograms per liter. So really what we're trying to get at is the lead is not correlated, it's not strongly correlated, there's not a good, strong relationship, so we are recommending that homeowners continue using lead filters, because having lead below the EPA action level in 1 year does not necessarily guarantee you're going to have low lead in the following year. So the other concern we found along with lead was looking at iron. Homeowners are concerned because of rusty water, red water complaints, and in keeping with what we saw with lead, water conditions are improving. We're seeing reduced lead or iron in water concentration shown by the mean. Looking at the secondary maximum contaminant level established by the EPA, we see in 2015, 7% of homes were above that secondary level. And then in 16, it dropped to 4%. So we're seeing a reduction in iron, we're seeing a reduction in red water complaints. However, as with lead, we are still seeing very high levels of iron in some homes. As Mark mentioned, in the late 2015, Flint Water and Detroit started adding corrosion inhibitors, orthophosphates. So we're interested in looking at how the phosphate levels were with the lead levels. So looking at this graph, these are the 174 homes. You can see phosphate on the x-axis and lead, first draw lead on the y. And there is a dark solid line. That is the target dose that the Flint Water Treatment Plant is trying to achieve. And what we can see is homes or data points to the right of that line actually have more phosphate in their water than that is being added by the treatment plant. So this is indicating to us that lead-bearing scale, leaded phosphate scales are still being mobilized in our water, and we're getting particulate lead. Homes to the left of that line, we're actually seeing phosphate levels less than what is our target level. So that's indicating to us that there are inadequate levels of corrosion control in our system, which we are thinking has to do with the age of the water and the limited water use Dr. Edwards previously mentioned. kind of further supporting this, we did a comparison looking at the zip codes and the change in lead based on that. And we found that overall lead concentrations are being reduced in most zip codes. However, one zip code, 48504, has seen steady lead concentrations and actually had an increase in the number of homes exceeding the EPA lead action level. So we're thinking, again, this has to do with the water age and the limited water use. So Mark, with that, I'm gonna give it back off to Mark to talk about water use.
And so when we looked at this data, our hopes were that the lead levels would have dropped more than they did and the iron levels would have dropped more as well. And one of the things we looked at were 2 homes at this point, this is a preliminary analysis, that had very persistently high lead. And we went and looked at the water bills and had discussions with those residents. And what we discovered is that many Flint residents are, not surprisingly, not using very much water. They're not drawing a lot of clean water into their home from the water main. And this is hindering the recovery of their home plumbing and also the cleaning up of the deposits that might be present in there. So amongst the reasons that the residents gave for their very low water use, which is on the order of 20 to 45% of the typical water use around the United States, is that there's concern about the cost of their water bill, so they're trying to save money. There's also concerns about the possible health effects still from the exposure, either in terms of the rashes or problems associated with bathing. And it's become common practice in some Flint homes to have no more than 1 quick shower per week. And on top of that, folks are using bottled water in many cases for bathing, washing dishes, and other uses. So as a result, the delivery of the cure, which is this clean water that needs to flow through the system, in some Flint homes, it's simply not happening. And according to one simple model, in a home using 20% of normal water use, it's going to take 5 times longer to clean up those pipes, get the biofilms and lead under control. And so this is the premise, this is the scientific basis, this is the actual on-the-ground data that is going to be supporting this recommendation of all the parties who were at the table in Chicago on Monday of last week, where we had a discussion about the system recovery. So overall, very clearly, Flint is not yet meeting the 90th percentile lead action level, and for that reason, people have to continue using bottled water and filters until further notice. The other thing that we want to emphasize is just because you had your water tested once and it was safe does not mean that your water is safe to drink. You should still be using the bottled water and filters to protect yourself and your family. There are very positive trends. There's no doubt the system is in much, much better shape than it was in 2015 in terms of lead levels, consumer complaints about red water, and also iron levels in the water. And the system is definitely on its path to recovery, but we've got to get more water flowing through the system to enhance that. And so there's going to be a program that I think is going to be rolled out by the EPA and the state in the next few weeks that has a short-term enhancement to the water use, and Virginia Tech is very, very supportive of that. So there were a lot of people involved in this from Virginia Tech, whole team of undergrads, grad, postdocs, Virginia Tech staff. But again, our thanks go out to the Flint residents for their amazing sampling in August 2015, as well as for redoing that with EPA funding in March 2016 to determine the current status of the system recovery. So with that, if anyone has any questions, we will be happy to answer those.
I was going to say, we'll take questions here from the room first. If anybody has a question here, I'll pass you a mic for the sake of the people who are observing on the live stream. And if not, or when we're done, we'll take phone questions as well. So any questions here from the back? Hearing none, Michael, we can go to the phone.
I can hear that. So.
Hello, this is Robbie Harris from VTF on the phone.
Hi there.
Hi, I don't know if I'm interrupting other questions on the floor there.
Just go ahead with it.
Okay. Just wanted to ask about Virginia, if this is a good time to do that.
Sure thing. Yeah.
Couple questions. Just specifically the Radford Arsenal and the idea that lead is coming from its open burning. Are you concerned at all about what that might be doing to the water?
Well, we have a lot of inquiries about what impact the arsenal is having on water quality in the state, and there are professors who are currently looking at that, but I have not seen any of those results.
Right. And are you concerned about the water here? We know that the wells are being tested now and have been for a while. Is the public water being tested and finding any lead, do you know?
Right. We very carefully tested the water in the Blacksburg system aftermath of the Washington, D.C. lead crisis. And in fact, we tested every tap in Montgomery County schools. We found some taps with very high lead. Those were remediated at that time. And in general, we do find that Blacksburg has some lead in water problems, but well within current federal standards.
And then Virginia in general, do you have any thing to say about overall? I know it's hard to get region by region.
Right. Well, obviously there are problems with private wells, as Dr. Pieper's dissertation work has shown, and those problems exist all around the country because there's no laws protecting people who are using private well water. So the outreach program had an article today about how they're doing testing in those homes for lead and other contaminants, and people are advised to take advantage of that. And yeah, but there are problems with water and wells throughout Virginia.
Right. Okay. Well, thank you very much.
You're welcome.
Hi, this is Aaron Martin from Detroit Public Television. I have a quick question for you. We've been speaking to a family in Flint that is suffering large and repeated boils from exposure to the water. I was wondering if you could tell us what the cause of that might be and a possible solution.
Okay. So the issue of rashes and hair loss is probably one of the most understudied issues scientifically in the water treatment field. There's currently very little basis for linking rashes and hair loss to water exposure. And that does not mean there is not a link. It just means that there have not been very good scientific studies that have found this agent or that agent in water and exposure to that will cause these problems. In fact, for rashes, I think the only study I'm aware of was one that we helped coordinate in Maui, Hawaii back in 2003, where residents were complaining about rashes. For years and years, their complaints were kind of dismissed. And then eventually we did an epidemiological study that showed the rashes were a certain type of bacteria known as Pseudomonas aeruginosa, and that this bacteria was not only present on the rashes, but it was in the water. There was a peer-reviewed study that showed after the water was changed and the bacteria levels went down, the rashes disappeared. But the type of rashes that are being observed in Flint now, especially the more persistent ones, do not have the characteristics of a biological agent causing them. I know that the Centers for Disease Control and the ATSDR, they're currently doing a study trying to look at linking various aspects of water chemistry to the rashes, both at the present time. But I can tell you because of the bad science on this, because there's almost no scientific research that has gone in and figured out causality or proven causality, it's very unlikely that they're going to be able to find a specific link. So the net result of all that is frustrating. It's frustrating as a scientist, it's frustrating for Flint residents. It could be that these rashes have nothing to do with the water. It could be that the rashes are due to, in some cases, less frequent bathing, for example. It could be due to the rashes are genetic or there's other environmental causes. So I think we're a long way, given the state of science in our field, to linking these types of problems to anything that's presently in the water and trying to link it to things that were in the water a long time ago is even harder because obviously the water is not there and we're late in the game to try to get to that. So again, just to reiterate, all of what I said does not mean that the water is not causing the rashes somehow, some way. We just don't have the scientific understanding to prove cause and effect. It's frustrating for everybody.
Mark, hi, it's Chris Marr at the Wall Street Journal. Hey, I was wondering if you could talk about the home with the lead level that was over 2,000. Was that a home that had low water use, or does it have a long service line?
Right, right. So we did not investigate that specific house. However, what I can tell you is that virtually all of Flint should be considered a high-risk zone for high lead in water. The problem is, again, these pieces of lead, either plumbing or lead rust, falling off into the water sporadically, and sometimes causing, you to collect samples that are over 1,000, 2,000, 5,000, even 10,000 parts per billion. And the issue here is, again, I hate to use the analogy, but it's apt. It's like Russian roulette. You could be at a house and have 5 or 6 samples with very low lead and think, wow, there's a good chance that I do not have any lead problem whatsoever. But given the present circumstances of the water, there's an unacceptably high risk that a piece of lead solder, a piece of lead rust from the service line might fall off into the water. And these levels of lead are just so high. Just to reiterate, I mean, if you have a glass of water at 5,000 parts per billion, that is enough to raise a child's blood lead from 0 up to 10 micrograms per deciliter with a single glass of water. A single glass of water at 2,500 parts per billion, that's enough to raise a child's blood lead from 0 up to the CDC level of concern, 5 micrograms per deciliter from drinking a single glass of water. So these problems are not confined to Flint alone. These problems occur, these random pieces of lead falling off in the water occur in cities all around the United States. The problem is right now they're occurring at a higher frequency in Flint because of the disruption that has occurred. And so this is the reason we're telling everyone to continue using bottled water filters regardless of what your past lead testing has shown, unless you're sure that you have no lead plumbing, which includes no lead service line, no lead solder, no lead brass in your house. So until this water emergency is declared over, again, Flint residents should be taking advantage of the free bottled water and the filtered use of filters. And the other thing, I'll give a shout out to great work that's being done by EPA. Out of an abundance of caution and with really good intentions, there was concern about a month or so ago that the filters would not be working effectively enough, especially in the homes that had the higher lead. Our testing, both in the field and the lab at that time, suggested that even the highest levels of lead in Flint, the filters, the NSF certified filters, would do a great job removing the lead. But to be extra cautious, the agencies, vulnerable populations, which included pregnant women, women who might become pregnant, and especially infants using formula, should be using bottled water and not filters while they checked out the actual on-the-ground situation in Flint. And the EPA has done that. They've done an amazing study, and with that supplementary data, which is on their website, we now know that even in the houses that tested highest for lead, those filters are working very, very effectively. So everyone should feel very confident in using the water that is treated by lead filters. So for the foreseeable future, both that or the bottled water is adequate, in my opinion, for everyone in Flint.
This is Michael Hood with the relief agency Crossing Water in Flint. We've got rapid response social service teams going into homes in the most affected areas currently. And we've gone into hundreds and hundreds of homes, and we get the question over and over again from residents. Is the water safe for them to bathe and shower in?
Right.
And that's what I'm asking you, I guess. Thank you.
Okay. So at present, we believe, based on very extensive monitoring of the system, that Flint's water is just as safe and probably safer than any other city in the United States. There's never zero risk from showering or bathing. There are people in many other cities who think that the water is giving them rashes, for example. There are people being exposed to Legionella in their drinking water in other cities as well. Certainly the risk for showering and bathing were too high for Flint residents if you look at the time period that Flint water was being used. But that was because chlorine was not getting throughout the system as effectively as the regulations require. And so at present, those chlorine levels are are heading back in a very good direction and are certainly much, much better than they were, and in fact are much, much better than in other U.S. cities. We've had about 6 months on the old Detroit water, and most of the biological monitoring of the system is showing that everything is within very, very normal ranges. So putting all that together, Flint residents should have no more concern about taking a bath or shower at present than anyone in any other city. Now that said, given the circumstances that occurred in Flint, it's perfectly understandable if people are afraid to take a bath or shower because they have been misled for a long, long time period. And some of those people are never, ever going to take a bath or shower again without some level of justifiable fear, given their experience. But scientifically, there's no reason to think that the risks are higher there. And the other thing I want to point out is that the risks of not bathing are also very profound, because bathing is part of basic hygiene, and we have to make sure our kids are bathed properly. We have to make sure everyone in Flint is bathed properly. So whether you do that by bottled water or sponge baths or normal showers or baths, that's an individual decision, just like it is all around the United States. But at present, we don't think there are any higher risks from bathing in Flint than in any other U.S. city.
Hi, my name is Sophia, and I'm a student from Smith College. And I was wondering about the water going through the pipes in Flint. If people are not feeling encouraged to keep sending the water through, running their water for bill purposes, is there a way that the EPA is going to encourage people to be running their water?
Thank you for that really great question. So there's a couple of dimensions to the answer to this. So the first question is, how do we make it financially feasible for Flint residents to use more water? So the governor's plan to give water bill relief is in effect and will be in effect until I think for a couple months after the expected end date of the water emergency. So the costs of using drinking water at present are much lower than they were during before the water relief bill came into effect. The second thing is that I know there is discussion, and where this goes I'm not really sure, but there is discussion about trying to get some kind of time period in which residents can use water for free to follow this recommended protocol, which again is designed to quickly run water through your pipes for maybe a period of a couple of weeks to enhance the delivery of chlorine, to enhance the delivery of phosphate, and to enhance the cleaning of the loose rust in the system. Whether that happens or not, it remains to be seen. I mean, obviously there's a lot of things that have to happen to make sure that takes place. But at present, I think the perception that there's a higher cost from running your water, given the relief, the relief bill that's currently in effect or is going in effect, it's not as costly to use the water as it once was. The other thing that we recognize from discussions with Flint residents is that there's a perception, and perhaps you could call it an urban legend, that if they use less water, they will have less corrosion problems in their house. There are actually many people who believe that if they use less water, their water will be better. And that is simply not the case. From every single scientific perspective, the more water that a resident uses, the better the quality of the water is going to be, whether it's for washing dishes, flushing toilets, or taking baths or showers. Now again, at present, no one should be drinking unfiltered Flint water. Everyone should be using the bottled water and the filters. So I hope that answers your questions, and we have a lot of work to do to educate people about just how important it is to use more water to help their plumbing system recover. And by the way, the individual efforts of everyone using more water would help the water mains recover as well. So this will have cascading benefits in terms of the healthiness of the system as this plan was implemented. And we don't have to keep this plan going for months or years. The idea is we need a short-term time period where water is used at this much higher rate to, again, help the system recover.
Mark, we have no more questions on the phone.
Thank you. I appreciate your reply.
Yep, thank you.
We have no more questions on the phone. Anybody else have questions here for Dr. Edwards?
Yes, sir.
Dr. Edwards, obviously your team has been at the forefront of this research. Now that you've gotten this most recent data, what's next for you and your team? Will you continue to do more testing in Flint? Where do you go from here?
Okay, so we are collaborating with all parties. First and foremost, we are continuing our partnership with Flint residents who really did most of the real hard work back in August of 2015, as well as March 2016. And again, just to reiterate the picture, not only the 10 residents who were led by Leanne Walters, who pulled off this sampling event in March, but also the 170 plus people that returned their sampling kits. This is really, really good data. And we have, the only valid points of comparison going forward, because there's no other data set out there that anyone's going to repeat, given the fact that the state data was collected using smallmouth bottles, pre-flushing. No one's going to do that again. So it's quite likely we will recommend to EPA and the state that this sampling event be repeated in about August of this year, because we thought maybe the system would be meeting federal safety standards now, but it's very clear that instead what it's shown is some problems to the recovery of the system. So the study was very, very valuable, because if we didn't see that the lead levels were too high and then go to these homes that had the high persistent lead, the issue of low water use at houses would not have cropped up as blatantly or become as high profile as it is. So armed with that information, we obviously have to implement a lot of remedial measures. Other things that are being discussed are enhanced flushing of the water main system, but that's being led by the EPA and the state. And so what I can tell you is, based on my interactions with all the parties, and that includes the emergency response team, EPA Region 5 and the state, that everyone is really on the same page. Everyone is working overtime to help Flint get back on its feet, to help heal these pipes, to help heal the people. The answer in terms of how long that's going to take, it just takes as long as is necessary. We don't have a lot of precedents for this. There's only 2 prior cases that I think have any relevance. The first is Washington, D.C., when they had their lead problems back in 2004, and they switched to orthophosphate. How long did it take that system to heal, to finally meet federal standards? It was about 1.5 years. And that was with orthophosphate in normal water use in Washington, D.C. Likewise, in Providence, Rhode Island, they had a lead and water problem. They readjusted, reoptimized their water chemistry. In that system, it took about 8 months for them to finally just barely get under federal standards. So those are the 2 time frames that we have where there's been particulate lead and water problems similar to what Flint experienced. this 8 months to 1.5 years. But again, that was with normal water use. And in some of these homes, we really just haven't made as much progress because not as much water has been flowing into the system. In terms of other work that our team's involved with, we have a very active program funded by the National Science Foundation to look at bacteria problems throughout the Flint system. And of course, everyone is very concerned about Legionella, Legionnaire's disease, but there are other bacteria issues in the system that include microbes that eat up pipes, microbial-induced corrosion. There are bacteria that cause odors. There are bacteria that potentially cause rashes, although we haven't seen those at high levels. So we're going to be actively monitoring the bacteria levels in the system as it recovers alongside our colleagues at the state and EPA and at the Fed. But I think, very clearly this is, it's going to be a good 1.5 to 2 years of concerted effort, cooperation. We're going to need some funding too to fix these pipes. And a lot has been made about the fact that the lead pipes need to come out. That's definitely true. But the water mains in Flint are also in very, very bad shape. And until those are kind of rehabilitated and in a proactive way, I don't think the system is really financially sustainable. So I really feel that the federal government, as well as the state government, owes it to Flint to help try to upgrade their water main system so that the system can become financially sustainable. So I will continue to advocate for that, and we will collaborate with anyone and everyone who wants to help Flint get back on its feet. That's our plan.
Questions from the back? Any more questions on the phone? I think we are good.
Okay, thank you.
Thank you very much for your time.
Thanks.
Appreciate it.